the Digital Health Applied Center is hosted at JKUAT, and it was out of a project that we did in 2016, supported by USAID. The idea was to create a facility that supports health informatics governance and data analytics. And we've done a lot of projects on e-health, and that is how we came about using the CHT Toolkit. Part of the work we did was to support the government dashboard on COVID. When COVID came, the dashboard which was hosted in our facilities to ensure that we can keep track of the numbers and inform policy. Some of the experiences, maybe I'll skip this. We've done some bit of projects and concentrate more on what we did. So this is a project that allowed us to use the CHT Toolkit, and the project was titled Utilization of Digital Tools to Enhance COVID-19 and TB Testing and Leakage to Care Among Bodaboda Riders in the Nairobi Metropolis. So we are looking at counties within Nairobi. That was Nairobi County. We had Machakos County. We had Kajiado, and we had Kiambu County. So this is one of the tents that we basically created. So the Bodaboda riders will come. But remember, most of it was at the bus stop because it was easier to get Bodaboda riders at the bus stop. Bodaboda is a Swahili word for a motorcycle rider, for those who do not know Swahili. Sorry for my assumptions. So this is what is called a Bodaboda rider. So it's basically a motorcycle rider. And because of the nature of their work, normally they have been neglected, and we wanted to bring them on board, test and find out their status of both COVID and TB, and of course link them. So we are working with hospitals that were near the centers where we are collecting the data. So we use the core framework. So we basically customized an app that was used, that is the Kenya COVID-19 tracker, and we basically modified one of the forms to add the screening questions we wanted to include based on our protocols. So we used an existing configuration. We just extended a bit of the questions and added our own questions. The configuration was done locally, hosted within JKUAT. We have a server, so we just created a virtual machine that did all the configurations on the local virtual machine. The challenge we had initially, all of the hierarchies worked well. So we had one national office, which was our Juja main. We had 4 county offices from the counties of interest. For each, we had the rapid response teams, and then the RRT teams, and then the rapid response officers who are basically collecting data. So we created 2 for each county, a total of 8. Then as the project progressed, we added more, especially in counties that had a lot of data to be collected. We created more accounts. So one of the challenges we faced, we realized in one of the counties, for example, this bit of the configuration was done correctly. And that's why I was interested in that bit. This bit was done correctly. But here, the hierarchy went this way instead of going this way. So getting this data was a problem. And we really struggled. And at some point, because the number of records became too much, we did not implement paging rules. We lost that data because the devices could not move. They hanged, and when restarting, everything went. So this was a challenge we faced. But of course, we configured targets, and the node and the members of the community were helpful. Anytime we got stuck, we'd ask questions, and we got answers. Quickly on our challenges, one was, of course, customization, and the challenge was some of the online documentation was not straightforward. So you read, you follow, and at times it's not clear exactly what you need to do. Remember this configuration, we did it internally here. We would just go online, read the documentation, and work on it. The other challenge we faced, we were collecting about 5,000 records. As the number of records increased, the devices became extremely slow. And if you go to the online documentation on the paging rule, you get a warning that do this very, very, very carefully. So the first time you're using the CHT toolkit, there's a warning on the online documentation. So I did not rush into creating the paging rule. And that costed us so much, especially towards the end, because the devices became extremely slow. At some point, I had to confirm the specs because we are using Samsung A3 tablets. We configured and confirmed that the specs were okay. But as I said, it was just too slow. So Bodaboda riders, because remember, they earn by transporting people. They are not patient to remain on site for long. So the more delays we had, the more people we lost. And that meant that reaching our target of 5,000 persons took slightly longer because of the slow nature of the device, especially during startup in the morning.